Let us talk about the role of antidotes in the treatment of poisoning. The major roles are given below. The antidotes may form inert complexes with the poison. They may accelerate the detoxification process of the poison. They reduce the conversion of the poison to a more toxic compound. Sometimes they can compete with the poison for the receptor, such as naltrexone competing for morphine. And some antidotes are physiologic antidote. They reverse the physiologic effect through other actions. So let's get some examples. Forming inert complexes. Classic example is iron poisoning, where we give desferrioxamine. And desferrioxamine is an iron chelator. It forms an inert complex with iron. And same goes for penicillamine. It forms an inert complex with copper. And there are some other chelating agents which bind with the minerals. Accelerating detoxification. Classic example is the acetylcysteine or N-acetylcysteine given in the paracetamol overdose, which accelerate the detoxification of the paracetamol, and actually N-acetylcysteine helps to regenerate the glutathione. Reducing the rate of conversion to more toxic compound. The classic example is giving ethanol in patient with methanol poisoning. Giving ethanol to a patient with methanol poisoning, and that prevents the conversion of methanol to more toxic compounds. And similar action is mediated by fomepizole, which reduces the conversion to aldehydes. Competing with poison for receptor, those are the direct antidotes of the poison, which bind to the same receptor. For example, patient with heroin or morphine overdose, we can give naltrexone or naloxone. And naloxone binds to the same receptor that the morphine binds, the mu, the kappa receptors. Then comes the reversal of the physiologic effect. The classic example is a patient with OPC poisoning, and we give atropine. Atropine does not readily bind to the OPC or compete with OPC. Rather, atropine binds to the muscarinic receptors and block the muscarinic receptors and producing an anticholinergic action. OPC is a cholinergic poison, and atropine has an anticholinergic effect. So there is the physiologic antagonism by the atropine. That is the first line drug for OPC poisoning patients.